When the patient was admitted into the hospital, then at the time of admission, the diagnosis was present or not, you need to identify. Only for diagnosis, not procedure, okay? Diagnosis, like ICD codes. While applying ICD codes, you need to check whether the condition was present or not present at the time of admission. Based on that, you need to give these POA indicators. So simply POA present on admission. Total 5 indicators available. Y, N, U, W and E. E for status codes. Okay. E for status codes. E means like Z series codes, status history codes. Okay. Status Z series codes. You can give E indicator. Then Y, N, U, W we can discuss. Okay. Y means yes. N means no. U unknown. W clinically undetermined. Clinically undetermined. Why when you will give present at the time of inpatient admission. The condition if present at the time of inpatient admission, for that diagnosis, you need to add Y indicator. You need to add Y indicator. N when we need to add?
Not
Not present at the time
for
of
the admission.
inpatient admission, which means the condition develops during the stay, during in the hospital. Okay. Remember here evaluation different and develop different. The condition must be developed in the inpatient hospital after admission. U. Documentation is insufficient to identify whether the condition was present on admission or not, which means while who will be giving these indicators? Who are adding these indicators?
Providers.
Provider.
Coder. No, coder. We are doing no. Provider not give indicators. They will give document. So coder's responsibility, right, to add the POA indicators. While you are doing your document, like when you are working on the chart or document, you only assign the diagnosis, right? Not provider, no. Coder will be assigned the diagnosis, right?
Yes.
Medical coder was the responsible person to assign the POA indicators. Okay, we are while working, we need to assign this indicator. So while you are reading the document, you are unable to identify whether the condition was present at the time of admission or not. Document was insufficient to identify. Document was not sufficient to identify the indicator. At that time, you need to add U indicator. U indicator you need to add. And you need to raise the query. You need to raise the query to provider. Okay, you need to raise the query to provider. So then the provider will give reply. So provider states the condition present at the time of inpatient admission, you need to change to Y. If provider states N, no, you need to change to N. If provider states I am also unable to determine, provider also not able to determine based on the document, then W. Okay, you need to assign W. If provider states unable to determine, clinically undetermined, what is the indicator?
W.
Coder unable to determine or coder not able to give the POA status?
U.
Based on the document insufficiency? U.
You.
Condition present at the time of inpatient admission?
Yes. Y.
Y. Condition not present at the time of inpatient admission? N. So here inpatient admission important, remember. Inpatient admission important. Based on the document, they will give inpatient return order time. Up to that time onwards, patient was considered as outpatient. After inpatient return order time only, you need to consider as inpatient. So generally, When the patient went to the hospital, they will get inpatient admission directly. They will give admission directly for the patient.
No.
No. From how we can admit to the hospital, how we can approach. If its situation was emergency, we can admit through emergency department. If it was normal, we can take the appointment and we can meet the patient, correct?
Yes, sir.
This is the general way. If when we are going any hospital, if emergency means they will admit through emergency department. If it was normal thing, we need to wait up to our appointment and we need to meet the patient. Then patient will decide, right? They wanna give inpatient or admission or not. They will decide whether we need to admit or not. They will ask, no, you can admit in the hospital or no need to admit, like that. They will tell, right? If you go any hospital, they will inform like that, no. So if our diagnosis was severe, they will ask to admit in the hospital. It was normal, they will discharge on the same day. Okay, so here provider will be responsible to give the inpatient written order time. Up to giving the inpatient written order time, we are considered as outpatients in the hospital. If you are in the hospital, but still you are not getting the inpatient written order time means, like admission means, you are a outpatient. So at the time of you need to give what indicator for that conditions. Before getting the inpatient written order time, any condition develop, what indicator you will get? What indicator you will give?
Yan.
Hmm.
Why?
When we need to give?
Why?
After inpatient admission time, no? See, N means
Why?
not present at the time of inpatient admission means if the condition present, how you will give N? Why?
Why?
Okay, the condition present at the time of inpatient admission, Y indicator. Suppose I will give one question. So patient was waiting in the hospital lobby. Okay. Patient fell from chair, got hip fracture. Okay, got hip fracture. So what is the POA for this hip fracture?
Why?
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 Why
Why?
indicator? Why indicator? Why indicator? Because patient not get the inpatient written order time here.
Mm.
So here patient not get the inpatient written order time, right? Suppose same question. Patient waiting in the hospital. Okay. Patient got the admission for CHF. Patient got the admission for CHF. So he was in the hospital for CHF treatment. She was fall from bed in the hospital. Done happened hip fracture. What is the POA for hip fracture?
N. Yan.
Yan indicator. Why? Because the condition developed in the hospital. Now clear, right? How to give POA status. For this, we have some guidelines. I will explain. Condition diagnosed prior to inpatient admission. So any condition diagnosed prior to inpatient admission, mostly chronic conditions like past medical history condition like asthma, COPD, diabetes. These conditions will not develop in the single time, right? So in this type of conditions, you need to give Y indicator like past medical history, social history, already present conditions from last years. Okay, we need to give Y indicator because these chronic conditions will not develop at the time, at a single time. Clearly present at the time of admission because they are mentioning the history. History means the condition developed in the previously. Then this concept remember clearly, conditions diagnosed during the admission but clearly present before admission.
Come again, sir.
Yeah, I will ask question. So patient was admitted, okay, but the condition was not showing at the time of admission, but condition clearly present before admission only, but it was revealed in the hospital stay.
Your voice is breaking.
Sorry.
N indicator. N, I think.
Suppose I will give an example. Patient admitted with motor vehicle accident. Okay. Motor vehicle accident. Multiple injuries happen.
Sir, your voice is breaking.
Still, for everyone,
Yes,
Clear.
Shiva.
Yeah.
for everyone it's breaking or only one.
Yes.
Now, am I clear now?
Yes.
sir.
Yes.
So my question was conditions diagnosed during the admission, but clearly present before admission, which means patient admitted with motor vehicle accident. Okay. Multiple injuries happen at the time of admission. So patient got admission. So they done X-ray chest. On third day, they revealed rib fracture. So how we will code this rib fracture POA status?
Yes.
Why Aryan?
Why?
N. N.
Why?
Why we need to give N?
Because the condition was not there at the time of admission, right?
So when it was developed?
After admission.
Before only. After admit.
No. It was revealed after admission, not developed, no?
Yeah, that's what. The condition was like if the patient is diabetic, it is before only.
See, here the thing is when it was developed or it was revealed, that's the important. Okay. The condition must be developed in the hospital, not revealed. Because now at the time of admission, patient, if you have motor vehicle accident or multiple injuries, they can't take all the diagnostic test at the time of admission, right?
Yeah.
So after the admission, patient will got admission, then they will order multiple diagnostic test. Based on the diagnostic test, they will get the result, correct? But the condition was clearly present at the time of admission. It was taken time to reveal. That's it, no?
Okay.
Yes.
So here the condition was revealed or developed. This gap you need to identify. Okay. If the condition revealed, you need to give Y. That's the point. Okay. Condition diagnosed during the admission, but clearly present before admission. For that, you need to give Y indicator. Suppose when we are admitting in the hospital, we are going to the hospital, we can express our condition or our symptoms to the physician. When we are going to the hospital, we tell I have coughs, SOB or fever, like symptoms only we can express na to physician, like abdominal pain or stomach pain, headache, whatever it may be. So we can tell our symptoms. Then physician, they will evaluate, they will give some orders. Based on that orders, they will identify the diagnosis. This is the common thing, right?
Yes, sir.
So if you say I have fever, they will order blood test. So if the blood test was positive for typhoid or malaria or dengue, the dengue was developed in the hospital or it was previously present to you?
Previously present.
Previous.
Okay, previously present to you because it was taken time to evaluate the condition. The dengue condition was clearly present at the time of admission, but it's taken time to evaluate. Clear? So at the time of admission, the condition present enough, not matter to reveal. So condition develops during outpatient encounter prior to inpatient admission, which means when we are waiting for the hospital or up to get the inpatient return order time, if anything happen in the hospital, you need to consider as outpatient and assign Y indicator for that conditions. Okay. up to getting the written order inpatient written order. After getting the inpatient written order, from next minute, if any condition develop, you can give N. Next concept. Documentation does not indicate whether condition was present on admission. So what we need to give if the documentation was not sufficient?
W.
W.
U.
So provider unable to determine
W.
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 So documentation states that cannot be determined whether the condition was present or not present on admission. W. If documentation does not indicate, like document was not support, coders are encouraging to raise the query. Must be raised from the POA status, which means the document you need to raise the query.
Shiva,
Your voice breaking, sir.
Sorry. So when we are adding U indicator, we need to raise the query, not complete the document. Okay. Clear? If you add U means you need to raise the query. That's it. U means query. Based on that, what reply you will get from the provider, you can change and you can submit your document. Okay. It's called as provider query. Like POA query, sir, not provider, POA query. Next concepts. Okay. So remember acute and chronic conditions. Acute and chronic conditions. So if the acute condition develops at the time of admission, why? Not present at the time of admission. If it develop after admission, N. For chronic condition, always Y. Okay, assign Y for chronic condition even though the condition may not be diagnosed until after admission. So for chronic condition, Y only you need to give. Acute condition means based on the condition when it was developed. For chronic condition, default Y. Clear? Like suppose they mentioned acute pancreatitis and chronic pancreatitis. So both are developed after admission. What you need to give? For acute pancreatitis, N. For chronic pancreatitis,
Y.
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 Next concept, codes that contain multiple clinical concepts. From here you will get one question, okay? Multiple clinical concepts. Here you will get question. So for some conditions, we need to check. Example, assign N if at least one of the clinical concepts included in the code was not present on admission. Suppose COPD with acute exacerbation and the exacerbation was not present on admission, which means at the time of admission, patient have COPD. After admission, it was exacerbated. So what we need to code? COPD or COPD exacerbation?
COPD exacerbation.
COPD.
COPD exacerbation we need to code. Okay, COPD exacerbation was the more severe condition compared to COPD. More specific code, more specific condition. So you need to give COPD exacerbation and you need to add YRN. N indicator. Then gastric ulcer that does not start bleeding until after admission, which means patient have gastric ulcer. After admission, it was started bleeding. So what we need to give an indicator? At the time of admission, patient have gastric ulcer, but it was started bleeding after admission. So for this situation, what indicator we will give?
Why?
No.
Y.
N.
N
N
indicator.
with
N
bleeding.
indicator. See here they mentioned clearly na N. Gastric ulcer that does not start bleeding until after admission. Okay, N. Asthma patient develops status asthmaticus after admission. N. So in these three concepts, you need to give N indicator. Okay. Remember, in these three concepts, one question you will get. In these three examples, you will get one question. Okay. Next, obstetrical conditions like pregnancy. Simple. If the condition present at the time of admission, Y. Develop in the hospital, N. Then perinatal, here remember. Perinatal means newborns. Okay. For newborns are not considered to be admitted until after birth. Means before birth you should not consider as newborn. After birth only you need to consider as newborn. Therefore, any condition present at the birth or that developed in utero is considered present on admission should be assigned Y. Which means for newborns, any condition develops by birth or during the delivery, you need to assign Y indicator. Okay, like during the delivery, cerebral hemorrhage or injuries. Okay, like otherwise, exposure to strep B vaccine in the vaginal canal. Okay, or meconium aspiration. Anything happened, any condition developed during delivery, you need to assign Y. Which means by birth, any condition develops Y. Okay. Congenital conditions. Congenital means anyone. Genetic disorder. By birth, the condition will develop and throughout the life, like genetical disorders. So congenital conditions also Y indicator. Congenital conditions also Y indicator. Clear?
Yes.
Yes.
Yeah. Now I will give examples. We can practice. Okay. Tell me answers based on your understanding. Right. Yeah. Tell me 23 question. Correct.
Yeah. Why?
Mhm. So
Why? Why?
a woman is admitted to the hospital for exacerbation of COPD and mentioned a lump she has noticed in her right breast. On the fourth day of her hospital stay, a biopsy is done of the breast lump and diagnosis of a ductal carcinoma is made. What is the POA for carcinoma?
Why?
Why?
Anyone? N?
And
And
So who are saying N? Why? Who are saying N? Tell me what is the reason why you are choosing N?
After
because condition
admission
not
on the fourth
at the
day,
time.
they diagnosed the lump. After
Okay.
admission only it was done, right? That's why it's N. But
Okay.
only during admission she just
So
mentioned it.
remember here, on fourth day, what they done? On the fourth day of our
Biopsy.
hospital stay, they taken biopsy, right?
Biopsy.
They taken biopsy for lump. For breast lump, they taken biopsy, no? Yes or no? So they done biopsy for the breast lump on the 4th day. Then that lump was evaluated as carcinoma. They identified it was not lump, it was carcinoma. That's it, no? They are saying it was a not lump, it was a carcinoma. They are saying based on biopsy report. So tell me now, it was developed in the hospital or it was clearly present before admission?
Clearly present before admission.
Why?
So clearly present because he was admitted with lump. Because patient will think it was lump, but they identified it was a cancer. That's it, no? So carcinoma will not develop in the single setting, like cancer will not develop in the single setting in the hospital. Okay. The condition was present, but it was taken time to reveal. So why indicator? Yeah. Tell me 20, 21, 22.
N.
20. A female patient is diagnosed with congestive heart failure and also have stage 4 pressure ulcer. Which of the following POA indicator must be present so that the ulcer will be classified as an MCC for the admission? So for that stage 4 ulcer, when it was developed, after admission or before admission?
After the admission.
After.
Before admission.
Before admission.
So
Where they
before
mentioned
admission.
that condition was developed after admission? See, if a female patient is diagnosed with congestive heart failure and also has stage 4 ulcer, they are clearly saying no. Patient have both conditions. So why indicator? Why? Then tell me 21 question. Understand the question, okay? An inpatient undergoes a procedure, okay? Inpatient was going to procedure and has a post-operative complication during the hospitalization, which means post-operative complication developed during the hospitalization. The insurance company will not pay for the entire amount requested. Which POA indicator is likely part of the reason for the reduced reimbursement?
N.
N.
In.
Yeah.
You. You or N?
Of insufficient documentation, that's why they are canceled.
Mm-hmm. See, when the post-operative complication developed,
After admission.
After the
surgery.
procedure done.
read here, and has a post-operative complication during the
Present words.
hospitalization, which means, what is that meaning? During the hospitalization, which means the
End.
condition present or not present? Has a post-operative complication during the hospitalization, which means that post-operative complication was present at the time of hospitalization or not? Give me
No.
that indication.
No.
Not indicator, I am asking. You can understand that first line, procedure, leave it. Patient undergoes a procedure, leave it. Has a post-operative complication during the hospitalization means that condition was present or not at the time of admission.
Present.
Present.
Present. Then why you need to say N? The condition was present during the hospitalization means Y indicator. Clear?
Yes.
Please. Next question.
Why?
Why?
Why? Why?
For 22 question, why Aryan?
Why?
No.
Why?
Why?
See, who are saying
Then
why? Read this guideline. Now only I discuss na for two conditions. COPD with acute exacerbation, gastric ulcer that does not started bleeding. What you need to give?
And more.
Yeah. So here, patient admitted with COPD with an acute exacerbation. Patient admitted with COPD with the acute exacerbation of chronic systolic heart failure. On day 3 of admission, the provided document, patient now expressing an acute exacerbation. So here, COPD acute exacerbation. Patient have COPD, acute exacerbation of chronic systolic heart failure. Don't confuse. Only COPD and acute exacerbation of chronic systolic heart failure. This acute exacerbation for chronic systolic heart failure, not for COPD. So what is the POA for COPD exacerbation now?
Then.
An indicator. Indicator. Why? Because patient have only COPD at the time of admission. After admission, exacerbation developed on day 3. Clear?
It has some chronic, right, Shiva? Chronic means always why, right?
No. They're asking for chronic, not asking for chronic systolic heart failure, no? They're asking for COPD POA.
Okay.
See, for which condition they're asking? COPD exacerbation they're asking. Clear? Now you understood, right?
Yes.
Thank you. So tell me first question answer.
B.
B.
Yes,
B.
B.
B. Why for fracture and CHF? Both are present at the time of admission.
Present.
Become ED for CHF got fractured in ED. ED was outpatient department, emergency was outpatient. Then move to IP admission. Fifth question.
N.
Question remember everyone, you will get in exam, okay?
N.
Clear? Gastric ulcer question you will get in exam. Tell me 15, 16.
Why?
15 Y, 16, 17.
Why?
Why?
16, why 17?
Yeah, no.
8.
17.
Gestational diabetes, why
Option A.
second
8.
degree laceration?
Yes, option yes. Gestational diabetes, why? Second degree laceration developed during delivery means after admission only, no? Yeah.
Mhm.
So now you understood the concepts of POA, right? 21.
Why?
Why?
Right. Mechanism aspiration at the birth. Y indicator. Clear, guys? POA
Yeah.
indicators clear?
Exactly.
Yes.
Any doubts still in POA concept? Remember, in this concept, any question if you get, you need to solve. It will be easy concept, okay? You will get 2 or 3 multiple choice questions. Okay? Next concept, PSI and HAC. In this concept, you will get 3 multiple choice questions, okay? In this concept also 3 multiple choice questions, you will get it also theory questions. No coding, only theory. This also concept based question. PSI means patient safety indicators. HAC, hospital acquired conditions. In the exam or when you are practicing the question, you will get these words PSI and HAC. Remember the abbreviation. PSI means patient safety indicator. HAC means hospital acquired conditions. So one question I will show, then you will get the idea about the questions. Read this question 75. 75-year-old patient is admitted for complex ventral hernia repair. So patient was admitted for ventral hernia repair. When in the hospital, the patient slips and falls, suffering a left hip fracture. With will the hip fracture will be identified as part of the facility patient safety indicator. Why or why not? Like this, you will get questions, okay? For PSI. So how we will identify that was PSI indicator or not? It was condition comes under PSI or not? It was difficult to identify, right? So they will give some the list of the PSI conditions. This is the list. There is no option. You need to remember the list of the condition names for PSI. Okay. These conditions only you need to consider as patient safety indicator, not for all the conditions. Tell me, what is the patient safety in hospital? Suppose you admitted in a hospital. They used one already used syringe they used for you. You will accept it?
No.
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 You will accept some safe and quality treatment in the hospital, right?
Yes. Yes.
Everybody will expect some safe and quality treatment in the hospital, no? Some mistakes happen, that's common, small mistakes. But everybody expect some safety and quality treatment in the hospital, okay? If they done mistake in this safety and quality, okay, to improve the quality and safe treatment of the patient, the indicators they developed, okay? If these conditions developed during the patient in the hospital, okay, for the patient in the treatment at the time of hospitalization, while they are treating, if the condition develops, you need to consider as patient safety indicator. Suppose pressure ulcer rate, which means you admitted with stage 3 pressure ulcer in the hospital. So during the stay hospital, the stage was increased. It will move to 4 or 5. Who's that mistake? If the
Hospital.
ulcer stage was increasing means they are not treating properly, no? Yes or no? They are not focusing on that pressure ulcers, right?
Yes.
Okay. So pressure ulcer rate. Then patient safety and adverse effect. Adverse if event composite. Adverse effect means side effects. Okay. Simple thing. Side effects. Side effects. Suppose while they are giving IV injection to patient, you get infection at the IV site because of nurse mistaken to give proper IV. So who's that mistake? Nurse mistake, right?
Yes. Yeah.
If they given properly that IV medication, why you will get infection at the IV site? If they cleaned or properly, if they administered IV medication, you don't get any infection at the at IV site, right? It was a side effect of that IV injection. No? If the nurse was not given properly, that's why you got infection. Here, patient safety was missed. Then pneumothorax and patient, remember only one fracture you will get under patient safety. Hospital fall with hip fracture. Patient was in hospital and hip fracture happened. Then it will comes under PSI. Not any other fracture. Remember only hip fracture develop in the hospital. Comes under PSI. Now tell me this question answer. So hip fracture comes under PSI or not?
Yes, it will come. Yes.
So it will comes. S means B or D. Tell me.
D. Option D.
A and C you eliminated. B or D. You will give PDX or SDX. Yes, C. Hmm? B for Bengaluru or D for Delhi?
D.
D. See, remember why we need to choose PDX? The reason for the admission was
Ventral hernia.
ventral hernia. So, ventral hernia was the PDX, na?
Yes.
So ventral hernia was the PDX, not fracture, right? The condition developed in the hospital, they are not admitted for fracture, no, here. So, yes, hip fracture is the secondary diagnosis and will be part of the patient safety indicator. Clear? Huh?
Yeah.
What is PDX means? Shiva?
Ventral hernia.
Primary.
So, for which condition they are admitting, that is the PDX. Reason for the admission related condition was principal diagnosis means first listed. Reason. So, patient safety you understood here. PSI. So, remember these conditions you need to by heart. There is no option. Clear. Post-operative respiratory failure, post-operative pulmonary embolism, post-operative sepsis, post-operative wound lesions. Maximum post-operative kidney injury will get post-operative hemorrhage. Only post-operative means after the procedure, if any condition develop in the list, you consider as PSA. Post-operative complications mainly. Because they are not done properly that operation. That's why they got complication. Now you understood, na? PSI.
Yes.
Next, hospital acquired conditions. Hospital acquired means the condition must be developed in the hospital. Okay. The condition must be developed in the hospital. These conditions, hospital acquired conditions, must be developed in the hospital. Remember here for hospital acquired conditions, what indicator you will give? POA?
N.
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 PSI indicators?
N.
N. Because that conditions also developed during the hospitalization only, no? POA was N. PSI and HAC conditions you will give N. Clear? You need to add N indicator compulsory. POA. So this is the HAC list, hospital acquired condition list. These conditions also you need to by heart. There is no option. Okay. This list of the diagnosis what they documented here, you need to by heart. I will share this PDF Word document with you. So here you will get two questions. How you will get, I will show. See this. Read the 74 question. Which of the following is found on the hospital acquired list? They given 4 options, right? So take the snippet for the question. I will put HSC list of the conditions. Now identify the HSC condition.
Foreign object.
Foreign body.
What? Foreign object retained. See, foreign body of the skin here. Here what they mention, foreign object retained after surgery, which means any foreign object, anything they missed in the surgery, after surgery, like when they are done appendectomy, they miss the scissors, they are put in the cotton and they complete the procedure. That was the foreign objects. Okay, if they miss anything in the body after completing the surgery, it was foreign object retained in the surgery. Foreign body knows not object na retained in the surgery. So read the question and understand the concept and read the
Pressure
that
also.
line. Pressure
Ulcers.
ulcer, stage 3 and stage 4. Stage 4 ulcer was the exact answer. Okay,
Yes.
UTI type 1 diabetes not there. Stage 4 pressure ulcer is there. Stage 3 and stage 4 ulcers. Clear up?
Yes.
Stage 3 and stage 4 ulcers was the HAC. Okay. Here you will get one question in exam. You will get, they will give stage 3 ulcer actually. They will give some condition like UTI pneumonia and ulcer stage 3 was developed in the third day. What is the HAC in this list, and they will give the stage 3 ulcer you will get. Okay. So read these diagnosis names. Clear? So how can I remember means I can't do anything. Definitely you need to remember. If you asking me, I am unable to remember means I can't do anything. Clear? This is the PSI and HAC. In this concept, you will get 3 multiple choice questions. Next concept, POA, clear, right? And that you will get 2 questions. Total 5 multiple choice questions we covered now, as of now. Okay. One more topic, CC and MCC. Okay. CC and MCC question. In this, you will get 2 questions. See, 36 question you can check. Which of the following diagnoses qualify as MCC? They given 4 diagnosis names, correct?
Yes.
So now can we identify
C.
A or B? So how can we identify that was MCC or not? First we need to learn, right? What is the MCC? How can we identify? Remember, MCC means major comorbid conditions. MCC means major comorbid conditions. CC means comorbid conditions. MCC conditions are mostly life-threatening conditions. Okay, very severe conditions. Okay. CC conditions was acute conditions. It was not life-threatening. It was just a severe. Okay. Life threat, where we need to identify this CC and MCC means. Where we need to identify these are CC and MCC means. In the ICD book, tabular list. Okay, you need to open tabular list. So beside of the tabular list, they given right here definition read the symbol meaning. What they are saying? MCC green tick. MCC green tick, what they are saying?
Major complication or
Major complication from
Major
coma.
complication or comorbidity, MCC. CC green tick means complication or comorbidity condition, CC. So if you identify these symbols beside of the ICD code, if you identified MCC symbol, it was a MCC condition. If you identify CC symbol, it was a CC condition. If it was HAC, they give HAC also like this, okay? HAC, MCC green tick, MCC condition, like C, pressure also HAC, MCCT condition also. Like that, we need to identify. If MCC means they will give MCC. If they are not given anything like this, there is no CC, no MCC, no HAC. No need to check anything. In the ICD diagnosis book, we need to search.
HCC.
MCC. HCC means hierarchical condition category. For HCC coding separate available. Na? So for us, as of now, no need to think about HCCs. Remember HAC and MCC. HAC means hierarchical condition category. It was separate coding. So now CC means CC. Now we need to identify the 4 diagnosis ICD codes first, correct? If you identify the 4 conditions of diagnosis codes, then you will get MCC value, no? Yes or no?
Yes.
Yes.
So first, what is the code for coronary artery disease?
I-25. I-25.
I-2510, right? I-2510. So it was no CC, no MCC. Next was aortic stenosis. What is the code?
I-41.91.
I-41.
I-48.
I-4891, no? No, not I-48.
I-4891 atrial fibrillations.
Yes, I-4891.
I-350.
I-4891 was AFib, unspecified AFib, 90. Unspecified AFib. Also, no, nothing, I-4891. No CC, no MCC. So aortic stenosis, I am asking.
I-35
I-35
0.
something, right?
I-35
Correct. Aortic I-35, aortic valve stenosis. It also no CC, no MCC. Then acute MI, type 2 MI. This code
I-21A1.
21, no?
I-21A1.
Myocardial infarction type 2. It was MCC, right?
Yes.
So
Yes.
they are given green tick also, MCC green tick. So what is the answer? Acute MI. So now you can tell me the answer for 36 and 37.
Option C.
B.
36.
I 54.3.
So I 50.43 was MCC. You are saying. Here they are giving ICD codes and they are telling which one is the MCC. I 50.9. No CC, no MCC. I 50.43. I 54.3 MCC. I 50.32 CC. I 50.20 CC. So these two are CC, only I 50.43 was
MCC.
MCC. 36.
B.
E.
Mhm.
Type 1 DM with ketoacidosis.
Ketoacidosis.
Yeah, ketoacidosis was life-threatening condition compared to remaining all. Okay. Ketoacidosis was the answer. It was the MCC condition. If you need to check the ICD codes for 11465, E10.61, then E10.1, and E11.42. Then you will get the confirmation of CC and MCC. Clear?
Yeah, clear.
Any doubt in the CC and MCC concept? So these
No.
36 question tell me which of the following is considered as CC? Hypokalemia, dehydration, hypernatremia, fluid over.
Hypernatremia. C.
So you can recheck properly. Okay, then you can identify. If you know already who are working in IPDRG, might be they know, I think. While you are working, you will get in the directly software only, we automatically capture this CC MCC. But for exam, we need to identify no? In book.
How to identify Shiva based on the name?
Based on the name, we need to search the diagnosis. Okay?
Okay.
We need to search in the ICD book actually. I will help you how to lead the codes in the ICD everything. Okay, later.
Okay.
You can remember up to now concept. While I am explaining ICD coding, I will teach you how to lead the codes in ICD book and guidelines, everything. As of now, you can understand the concept. Okay.
Okay.
So all are having knowledge, you can tell me. Hypokalemia, what is the code? Is 875. Huh?
Yes.
E86.0.
No. E875, right? Yeah, hypo E876. No CC, nothing. Next. Dehydration E860, right? Nothing. Then hypernatremia E87. Huh? E871. 0. This is CC. Hypernatremia. Fluid overload E860. Volume depletion only, no? Fluid overload. What is the code for fluid overload? I think E869. Volume depletion only. Or here the other fluid overload.
877.
Yeah.
E8770.
Sorry. This also no CC, MCC, no? So which one is CC here?
Hypernatremia.
Hypernatremia. Like this, we need to identify. So clear, right? So any doubt in this concept, you will get two multiple choice questions. Okay. How we will get, I will show. Yeah. 17th question. 17. 14th question, tell me. Patient admitted to the IP hospital with NSTEMI noted to have acute kidney injury as SDX, which would be appropriate DRG on this case. How we will give a DRG value now? 280 means MI with MCC, 281 MI with alive CC, 282 no CC, no MCC, 284 expired. So patient was not expired, no? They didn't mention. So it was CC or MCC or without CC, MCC. If you identify AKI, you will get answer. Acute kidney injury was CC condition, so 281 was the answer. Now tell me, in DRG 637, diabetes with MCC, in below options, which MCC affects the selection of MS DRG? In these four conditions, which one is the MCC?
Acute respiratory failure.
So acute respiratory failure was the MCC, so that's why you need to select acute respiratory failure. Like this, okay? CC-MCC 2 questions, HAC-PSI 3 questions, 5, and POA 2. 7 multiple choice questions we covered today. Clear?
Yeah, clear.
In this concept, any doubt you can ask me, okay? These all are basic, like inpatient related basic stuff. If you have any doubt, you can ask me, guys. Why I'm explaining inpatient, a lot of people know ICD CPT. If I will explain inpatient related stuff and I will give paper, they will read themselves, no? At least.
Hello, Shiva.
Bolo Dhananjay.
Where can we find HCPS and PSI conditions?
I didn't get you.
Where can we find HCPS and PSI conditions?
We didn't get in the book actually. We need to by heart this list. I will share this document with you, okay? We need to by heart the list of the PSI conditions and HAC conditions. I will share this PDF Word document with you in group, okay?
Okay.
Shiva, this video also will get, no?
Yes, I will definitely share, no? After the class.
Apart from the case studies, the rest of the questions will be like this only, sir, or else a coding part will be there.
Coding part also you will get ICD, CPT, PCS related coding also you will get. Theory also you will get. Both. Okay. Out of 86 multiple choice, no? At least 40 questions theory, 46 coding.
Okay.
Half of the questions theory only. So that's why there is no much needed focus on the coding in the exam actually. We need to understand the concept. Basic concept related, you will get more questions. Okay. Coding you will use only in the case scenarios, complete coding.
Okay, sir.
Multiple choice, most of the questions theory only. Any doubt in these concepts? If you are clear, we can discuss tomorrow some other topics. Okay. Clear means I will close the session. That's all.